Hello everyone, welcome to Texture Myth. In this session, we are going to talk about another very important topic related to medical coding anatomy, where we will see what is deep anatomical term of direction or what is internal anatomical term of direction. So if you remember, in our last session, we talked about the superficial and external, right? So this session is in the continuation of the same, where we are going to mainly talk about the deep or internal anatomical term of direction. So by the end of this session, you will be able to understand what it is, what is the exact definition that you can use in interviews and exam, and also we will see some of the great example that will help you to understand the concepts properly. Also, we will discuss some memory tips or interview question that would be helpful for us for the interviews and examination. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on deep and internal, but prior to that, you should know what is deep and internal. You should know about other things that we have already covered. Okay, and for that you can also refer the Texture Myth digital course book, which is freely available in the description box. So there you will find thousands of sessions which are available in both Hindi as well as English language. So as per your convenience, you can consume the content, and in case if you have any questions related to that, you can simply reach out to me through my comment section. I would be more than happy to answer all your questions there. Clear? Alright, so let's get started. Here you can see we will start with the definition itself. So if someone asks you what is deep or internal, you can simply say deep means farther from the surface of the body or toward the inside of the body. Okay, so in simple words, any structure or body part that is farther away from the skin or outer surface and is located more toward the interior of the body is called deep. Okay, so deep is completely equal to the farther from the surface toward the inside or away from the skin. Okay, now we also have one synonym for this deep or internal. For deep, the synonym is internal, so deep is also called as internal, but both words are related in the meaning. That means both representing toward the inside or away from the surface. Now some of you might be thinking, like, then in that case, what is the difference between deep and internal? So there is a difference between deep and internal. Like deep is, it means farther from the body surface and skin, but it is commonly used in general anatomy and clinical medicine. Whereas if we talk about internal, it is toward the inside or inner surface. Meaning is again same, but it is most commonly used for hollow organs, body cavities, and specific anatomical structure. Okay, so we can conclude that deep is used when comparing the depth of structure, how far something is from the skin surface. Internal is more commonly used when describing inside a hollow organ of the body cavity. Clear? Fine. Now let's see some example. So the internal surface of the stomach means inside the wall of the stomach. The internal ear means the innermost part of the ear deep inside the skull. Now we have some general terms, like here you can see in general anatomy, both terms are used and are closely related in the meaning. However, they are not always perfectly interchangeable. Okay, that means they are not interchangeable. Why it is not interchangeable? If you remember, in superficial also we discussed this point, that superficial is not also the interchangeable. But other than that, whatever we have discussed so far was interchangeable, correct? But it is not. So this is something that can be your interview question, so always prepare accordingly. Okay, so deep refers more to the distance from the skin, while internal refers more to the inside of the structure of the cavity. Okay, Fine. Then next is opposite term. So yeah, the direct opposite term of deep is superficial external, which we have already discussed in last session. So we can say that deep is farther from the surface toward the inside, and superficial is closer to the surface toward the skin. Okay, these always work as a pair. You cannot understand one without knowing the other one. If we talk about examples, so the bones are deep to the muscle, the skin is superficial to the muscle. Now let's see some more examples so that we can easily relate the things. So here you can see I have noted down comparison example. So how to use it in a sentence. The bones are deep to the muscle. That means the bones are farther from the skin surface than the muscle. The brain is deep to the skull. The brain is farther from the surface than the skull bones. The transversus abdominis is deep to the internal oblique, which means the deepest abdominal muscle is farther from the surface than the middle layer. The pectoralis minor is deep to the pectoralis major, the smaller chest muscle that is far from the surface than the chest muscle. Okay, fine. Now let's see some of the medical related terms. So the first term is DVT, which is deep vein thrombosis, which means blood clot in the deep veins of the leg or pelvis, very dangerous. Deep wound, a wound that penetrates through skin and subcutaneous tissue into muscle, tendon or bone. Deep partial thickness burn means a burn affecting epidermis and deep dermis. Deep second degree burn. Okay, so this is called second degree burn, where a burn is affecting the epidermis and the deep dermis. Okay, so if both epidermis and deep dermis are affected, then we will call it as a deep second degree burn. Next is deep surgical site infection, post-operative infection involving deep tissue below the fascia is SSI. Okay, so SSI is also a part of deep surgical site infection. Deep SSI means deep surgical site infection. So these are some examples. Now let's see, because we have learned so many things, right? So how you will remember all these things? So for that there is a trick I'll show you. Like deep is started with the letter D. Okay, so where D means down the surface, down below the surface. Okay, which is equal to the far from the skin inside the body. So you can simply consider that deep means buried far inside, like something buried deep underground. Okay, superficial equal near to the surface, like something lying on the top of the ground. Deep is what you cannot see or touch through the skin. Superficial means what you can almost see or feel through the skin. Now you can also compare the superficial and deep with the onion, because the outermost layer is equal to the most superficial layer, and the innermost layer is called the innermost core layer is called the deepest layer. Okay, so peeling each layer takes you progressively deeper. So the surface of the water is superficial. Another example is for ocean. So if you compare it with ocean, so the surface of the water is superficial and the deep sea floor deep down is deep. So just like a body, the skin is surface and the internal organ are the deep floor. So I hope now it is quite clear what is deep and internal, what is superficial and external, what are the difference between them. Okay, so now there is one question for all of you. So the question is, what is superficial anatomical term of direction? So in our last session we discussed this in detail, so I hope you will write some better answer for this, not just a short one. Okay, because this thing we have already discussed in this session as well, and I'm sure like you already know the answer of this question, so you can just simply share your expertise in the comment section so that others can take a reference format. Also, when you write the answers in the comment section, it will give me the idea that you are learning from these sessions, and then you can simply provide me the indication that yes, you are learning from this session, and accordingly I will release the next sessions that I have already prepared. So as many comment you can, like the number of comments I will get, accordingly I will release the sessions. So yeah, that's all for today. I hope this session is clear to all of you. In the next session, we will discuss few more things. So thank you for watching Tech Sharmat.